The so-called 301 study was a comparison of capecitabine versus eribulin in patients who could have had up to 2 prior treatments for metastatic disease or 3 total chemotherapy treatments. And the goal, of course, from a development standpoint, was the hope that eribulin would be superior. If you look at the data from the trial and look at the curves, there is complete overlap of PFS and overall survival for the entire population treated. So it didn't look like there was a huge advantage, if anything, for eribulin for the total population treated compared to capecitabine. However, if you look at the subsets of patients, including those that were HER2 negative and those that were defined as triple negative ER/PR and HER2 negative, of which there were a couple of hundred, there was an advantage favoring eribulin, and there appeared to be a survival advantage. Now, of course, we're looking at subsets, smaller numbers than the total population, but clearly in that group there was a hint, a signal that eribulin might be particularly effective. So although it could be spun as a negative trial, I would also interpret it as a trial that shows eribulin is equal to another drug that's used very commonly in earlier stage metastatic breast cancer treatment, not salvage therapy 4th or 5th line. So it looked very similar to capecitabine and a signal that it might be effective in a particularly troublesome subset of breast cancer, triple negative disease.